Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Have you ever really thought about how often convenience foods sneak into your day? You know, that hot dog at the game, maybe a soda with lunch, that quick snack you grab off the shelf. These seem pretty minor, right? Small choices. But what if those seemingly harmless everyday foods were actually subtly shaping your health continuously in ways we're only just beginning to really grasp?
It's a really important question. And
Yeah.
that's exactly what we're going to explore today. We want to cut through some of the noise
Yeah.
and really dig into some groundbreaking new research. We're looking at things like processed meats, sugar-sweetened beverages, trans fatty acids, and also that big, sometimes confusing category,
Oh, yeah.
ultra-processed foods.
Yeah, our goal here is to give you some crucial insights. Stuff that goes, well, a bit beyond the usual dietary advice, helping you understand what these common foods might mean for your long-term well-being. And we're drawing on some really solid sources for this deep dive. There's a major study just published in Nature Medicine, a top journal, and also a really comprehensive review from another journal, Nutrients. And together they paint a remarkably clear picture, and honestly, a pretty startling one.
Definitely startling. So maybe let's start by just clarifying what exactly we're talking about. These dietary factors under the microscope. First up, processed meat. What is that, really? It's meat that's been preserved, so smoking, curing, salting, or adding chemical preservatives. Think bacon, sausages, deli meats, that kind of thing. The issue is that these processes can create compounds, things like N-nitroso agents that are implicated in tumor development.
Right, so it's not just about the fat content or the salt necessarily. It's the actual processing creating potentially harmful substances. Okay, what about sugar-sweetened beverages, SSBs?
Yeah, SSBs. This is a big category. It's not just sodas, although they're a huge part of it. It also includes most fruit drinks, the ones with added sugar, not 100% juice, sports drinks, energy drinks, even many sweetened teas and coffees you might buy. For many people, these are the primary source of added sugars in their diet. And we already know they contribute to weight gain and increase the risk for things like cardiovascular disease and type 2 diabetes.
Okay, so processed meats, SSBs, and the third one was trans fatty acids.
That's right, trans fats. We're mostly talking about artificial trans fats here, the industrially produced kind. They're made by taking liquid vegetable oils and making them solid, basically, through a process called hydrogenation. This makes products cheaper, more shelf-stable, think some margarines, packaged baked goods, fried foods. And they've been linked for a long time now to systemic inflammation and, significantly, coronary heart disease.
It's important you mention the industrial kind because there are tiny amounts naturally in some foods, right? But that's not the focus here.
Exactly. The focus is squarely on the industrially produced ones. So those are three specific types. But then there's this much broader category that's really changed how scientists think about food lately. Ultra-processed foods, or UPFs.
Right, the UPFs. And understanding these involves something called the NOVA classification system, which you mentioned is a name, not an acronym.
Yes, NOVA. It's a way of categorizing food based not just on nutrients, fat, sugar, salt, but on the extent and the purpose of the industrial processing it undergoes.
So it's about how much processing and why it was processed that way.
Precisely. Ultra-processed foods are basically industrial formulations. They're made mostly from substances extracted from foods or synthesized in labs. Think protein isolates, modified starches, hydrogenated oils, and they often contain additives to make them hyperpalatable, intense, sweeteners, colors, flavors, emulsifiers, things you generally wouldn't use in your home kitchen. We're talking packaged snacks, sweet or savory, reconstituted meat products, frozen pizzas, ready meals, most confectionery. It's a huge part of the modern food supply.
That NOVA system really does offer a new lens, doesn't it?
Okay.
So knowing these definitions, how did that big Nature Medicine study actually investigate the risks? What was their approach?
They use a really rigorous method. It's sometimes called a burden of proof approach. Essentially, they pool data from lots and lots of large existing studies, prospective cohorts, some case-controlled data. Hundreds of thousands of people involved across these studies. And they didn't just average the results. They used sophisticated statistical methods, meta-regression, to look at the dose-response relationship.
Dose response, meaning how the risk changes as the amount consumed changes.
Exactly. They wanted to see if risk went up as intake went up, and importantly, how it went up. Was it linear? Did it plateau? They also specifically tried to account for inconsistencies between the studies and aimed for conservative estimates. So trying not to overestimate the risk, it gives more reliable picture.
Okay, that sounds robust. So with that powerful method, let's get to the findings, because you said they were startling. What did they find about processed meat?
They were indeed. For processed meat, they found pretty clear links. Consuming it regularly was associated with a significantly higher risk of type 2 diabetes. Even small amounts, starting from less than a gram per day up to about 57 grams, showed an average risk increase of at least 11%. And to put that 57 grams in perspective, they estimated that eating 50 grams a day, roughly one standard hot dog, increased the risk of type 2 diabetes by about 30% compared to eating none.
30% increase for type 2 diabetes from basically one hot dog a day. Wow, what about other conditions?
Colorectal cancer was another one. Consumption between about 0.8 grams and 55 grams per day was linked to a 7% higher average risk. And again, at that 50 grams per day level, the estimated increase was substantial, 26% higher risk for colorectal cancer.
26%, that's significant.
It is. For ischemic heart disease, the link was a bit weaker, what they called a one-star rating in their system. But still, 50 grams per day was estimated to increase risk by about 15%.
Okay, but here's the part that really jumped out at me from the outline. You said the risk increased continuously.
Yes. This is crucial. For both type 2 diabetes and colorectal cancer linked to processed meat, the risk didn't just appear above a certain threshold, it increased continuously with any level of consumption they could measure. And perhaps most concerningly, the steepest increases in risk actually happened at the low end of consumption, what many people might consider normal everyday amounts, like one serving or even less per day.
So there's no apparent safe amount when it comes to these specific risks from processed meat. The more you eat, even starting from tiny amounts, the higher the risk climbs, and it climbs fastest when you go from none to a little bit.
That's what this evidence strongly suggests, a continuous risk relationship.
Okay, what about the sugar-sweetened beverages, the SSBs?
Similar pattern, unfortunately. For type 2 diabetes, intake ranging from just 1.5 grams up to 390 grams per day was associated with at least an 8% higher average risk. And they estimated that drinking 250 grams per day, that's about 8 ounces, like 3/4 of a standard soda, can increase the risk of type 2 diabetes by 20%.
20% again, and heart disease.
For ischemic heart disease, the link was there too, though maybe slightly less pronounced. Intake up to 365 grams per day showed a 2% higher average risk. That 250 grams per day, the 8 ounces, was linked to about a 7% increased risk for ischemic heart disease. And just like with processed meat, the risk increased monotonically, meaning steadily upwards, with the sharpest jumps again seen at those lower intake levels.
So even just one sugary drink occasionally isn't necessarily consequence-free over the long term, according to this?
It seems that way. The risk adds up, starting from low consumption.
And the third one, trans fatty acids.
The industrially produced ones, yes. The findings here were also quite stark, particularly for ischemic heart disease. Consuming between 0.25% and about 2.5% of your daily energy intake from these fats was linked to at least a 3% higher average risk. Getting just 1% of your daily calories from industrial trans fats was estimated to increase heart disease risk by 11%, 2% of calories from them, a 20% increased risk.
20% risk increase from just 2% of your calories? That's potent stuff.
It's strongly potent. And critically, the paper states, for industrially produced trans fats, no safe level of exposure observed.
No safe level observed. That phrase keeps coming up. It's powerful. Now, you mentioned a 1-star rating for processed meat and heart disease. Most of these other links we just discussed, they got 2-star ratings, right? What does that distinction mean?
Right. The star system was their way of grading the overall confidence in the association, considering things like the size of the effect and the consistency across studies. 2 stars generally means the association is statistically significant and considered adverse, but maybe the effect size is relatively small or there was some inconsistency, some heterogeneity in the underlying studies. It's definitely not saying the risk isn't real. It's more like a scientific rating. Think of it as a strong signal, a solid yellow light, indicating a genuine risk that warrants attention, even if more research might refine the exact magnitude.
Okay, so it's a strong warning sign based on the available evidence. Got it. So that covers the big 3 from the Nature Medicine study. But you mentioned the other review, the one in Nutrients, looked more broadly at ultra-processed foods, the UPFs. What did that find?
Yes, that review cast a much wider net, looking specifically at studies focusing on ultra-processed foods as defined by Novia. And the picture was, well, overwhelming. They looked at 43 published reviews or meta-analyses. Of those, 37, a huge majority, found statistically significant associations between higher consumption of UPFs and adverse health outcomes.
37 out of 43 found negative links. What kind of health outcomes are we talking about? Is it the same stuff, diabetes, heart disease?
Those were definitely included, yes. Lots of cardiometabolic risks: overweight, obesity, metabolic syndrome, high blood pressure, unhealthy changes in blood fats and blood sugar. But it went much further. It also found links to all-cause mortality, dying earlier from any cause. Links to cancers, including overall cancer risk and specifically breast cancer, cardiovascular disease, coronary heart disease, cerebrovascular disease.
Wow, it's a broader list than just the previous three categories.
Much broader. And even beyond those major diseases, they found associations with things like irritable bowel syndrome, depression, frailty in older adults, and even asthma in children and adolescents.
That's quite a list. It touches almost every system. Now, here's something that really caught my eye in the notes: the beyond nutrients idea. This review apparently found that these links often persisted even after researchers accounted for the usual suspects: sugar, salt, fat, fiber, overall diet quality.
Exactly. This is perhaps the most crucial takeaway about UPFs. It suggests that the problem isn't just that these foods are often high in sugar, salt, and unhealthy fats, or low in fiber. While those factors definitely contribute, the adverse associations often remain even when you statistically control for them. This strongly implies that something about the ultra-processing itself is contributing to the harm, independent of the nutrient profile alone.
So the sum is worse than its parts, in a way. It's not just the ingredients list, but the whole industrial formulation.
That's the hypothesis, yes. And we actually have some direct experimental evidence for this from a really important randomized controlled trial, the one by Hall and colleagues back in 2019.
Oh, right, the RCT. Tell us about that one.
So they took participants and had them live in a clinical research center for a month. For 2 weeks, they ate a diet composed primarily of ultra-processed foods. For the other 2 weeks, they ate a diet of unprocessed or minimally processed foods. Critically, the two diets were carefully matched for calories presented, sugar, fat, sodium, fiber, macronutrients, pretty much everything you'd normally track. People could eat as much or as little as they wanted.
So the diets look similar on paper, nutrient-wise, but one was UPF and one wasn't. What happened?
The results were striking. When people were on the ultra-processed diet, they spontaneously ate more, about 500 calories more per day on average, and consequently, they gained weight about 0.9 kilograms, or 2 pounds, in just those 2 weeks. When they were on the unprocessed diet, they naturally ate less and lost about the same amount of weight.
Even though the diets were matched for all those nutrients. That's incredible. It provides causal evidence, doesn't it? That UPFs drive overconsumption and weight gain independent of their basic nutrient content.
Precisely. It strongly suggests something about the nature of UPFs encourages us to eat more and gain weight. So the next logical question is how? What are the proposed mechanisms?
Yeah. What's the science thinking is going on? If it's not just sugar and fat, what is it about the processing?
There are several leading hypotheses, and it's likely a combination of factors. One is the physical structure. Ultra-processing often breaks down the food matrix, making it softer, easier to chew, quicker to eat. This might lead to faster energy intake and less effective satiety signals.
So you eat more before your body realizes it's full.
That's part of the idea, yes. It might also affect hunger and satiety hormones. Some studies suggest UPFs might lead to lower levels of appetite-suppressing hormones like peptide YY, and perhaps affect hunger hormones like ghrelin, basically messing with your body's fullness cues.
Okay, physical structure, hormone signals.
Yeah.
What else?
Inflammation is another big one. Industrial food additives, emulsifiers, artificial sweeteners, things like that. And perhaps the processing methods themselves might contribute to low-grade systemic inflammation or negatively impact the gut microbiome, that community of bacteria in your gut.
Right, the gut health connection seems increasingly important.
Absolutely. Then there's the displacement effect. If you're eating a lot of UPFs, you're probably eating fewer whole, minimally processed foods, fruits, vegetables, whole grains, legumes, which are packed with protective nutrients, and fiber. So you miss out on the good stuff.
That makes sense. And the final piece.
Finally, we can't ignore the environment and the nature of the foods themselves. UPFs are typically cheap, incredibly convenient, widely available, and heavily marketed. Plus, they are often engineered for hyperpalatability, that perfect combination of salt, sugar, fat, and texture that makes them almost irresistible. Some researchers even talk about quasi-addictive properties promoting overconsumption.
So it's a perfect storm, really. Body signals getting confused, inflammation, missing out on good foods, and then these products being pushed on us and designed to be hard to resist.
It really paints a complex picture of how these foods impact health beyond just their basic nutrient labels.
Now, this is all compelling, but as with any science, especially nutrition science, it's important to talk about limitations, right? To keep things in perspective.
Absolutely crucial. Scientific honesty demands it. The biggest limitation for much of this research, especially the large reviews, is that they rely heavily on observational studies. Observational studies can show strong associations like people who eat more UPFs tend to have higher rates of disease X. But they can't definitively prove causation. They can't prove the UPFs cause the disease.
Because there could be other factors involved, confounding factors.
Exactly. Researchers try very hard to adjust for known confounders, things like smoking, exercise levels, income, overall calorie intake. But there's always the possibility of residual confounding factors they didn't measure or couldn't measure perfectly that are influencing the results.
What about actually measuring what people eat? That seems tricky over long periods.
It is. Most large studies rely on tools like food frequency questionnaires, where people try to recall what they ate over the past weeks or months. There's bound to be measurement error there. People might forget or misjudge portion sizes or even report eating healthier than they actually do.
That makes sense. And you mentioned heterogeneity earlier.
Yes, that's another challenge. The studies being combined in these reviews often differ. They might define ultra-processed food slightly differently, especially in older studies before Novi was widely adopted. They study different populations, follow them for different lengths of time, adjust for different confounders. This variation, or heterogeneity, can make the overall picture a bit noisy.
Okay, so observational data, measurement errors, differences between studies, those are important caveats. But despite these limitations,
Despite the limitations, the sheer consistency of the findings is really striking. When you see dozens of studies conducted in different countries with different populations using slightly different methods, all pointing towards a similar pattern of adverse health associations with processed meats, SSBs, trans fats, and UPFs, that strengthens the overall confidence considerably.
the weight of the evidence points in one direction, even if each individual study has flaws.
Precisely. It builds a compelling case that these dietary patterns pose a genuine health risk.
So given that, where does the research need to go next? What are the priorities to get even clearer answers?
Well, more high-quality randomized controlled trials like the Hall study are definitely needed. They provide stronger evidence on causality, especially for mechanisms like appetite regulation and weight gain. We also need to expand the research. Most studies are from high-income Western countries. We need more data from diverse populations, especially in low- and middle-income countries where UPF consumption is rising rapidly. And, importantly, more research focusing on children and adolescents, tracking effects from a young age.
And understanding the how better, the mechanisms.
Yes, absolutely. Deeper investigation into the precise biological pathways is key. How exactly do these foods affect inflammation, the gut microbiome, hormone signaling, metabolic processes? This might involve advanced techniques like omics technologies, looking at genes, proteins, metabolites, or methods like Mendelian randomization, which uses genetic variations as a proxy for intake to help tease out causal effects.
So using genetics to help understand dietary impacts, that's fascinating.
It's a powerful tool. And finally, on a practical level, continued efforts to standardize the definition and assessment of ultra-processed foods across studies would really help improve consistency and comparability globally.
Okay, so wrapping this all up, what's the main takeaway for someone listening right now? What should they take away from this deep dive?
I think the central message is pretty clear and maybe a bit sobering. Even what seems like small, regular amounts of processed meats, sugar-sweetened beverages, industrial trans fats, and ultra-processed foods in general are consistently linked to measurable increases in the risk of serious chronic diseases.
And crucially, it's not just about the sugar, salt, or fat content anymore. The evidence strongly suggests the processing itself, the whole package of how these foods are made and formulated, plays a really significant role.
Exactly. So this knowledge really empowers you, the listener. It encourages you to think critically about your own food choices, maybe shifting the focus a bit, not just counting calories or macros, but also considering the degree of processing in the foods you eat regularly.
It gives you a new framework for making informed choices for yourself, for your family.
It does. And beyond individual choices, these findings have huge implications for public health. They add weight to calls for policies like taxes on sugary drinks, bans on trans fats, maybe clearer front-of-pack labeling that indicates processing levels. It really highlights the need to incorporate this concept of ultra-processing into national dietary guidelines.
Which mostly haven't caught up yet, have they?
Not fully in most places. They still tend to focus primarily on nutrients rather than the processing aspect.
So maybe a final thought for everyone listening to carry forward. How does really understanding this ultra-processed dimension change how you look at your next grocery run or your next meal? Or even how you think about the entire food system that makes these foods so available?
And following from that, maybe ask yourself, what small intentional changes could you explore? Could you perhaps swap out one regular UPF snack for a piece of fruit? Or try cooking one more meal from scratch this week? It's about finding sustainable ways to shift towards more minimally processed options in your daily life.
Thanks for tuning in to the Health Headliner podcast by Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.